Hi, I'm Dr. Cooley, and I'm going to be discussing why someone would want to perform muscle testing. So there's three main reasons why someone would want to perform muscle testing on the patient. The first reason is it provides objectivity to a patient's complaint. Patients come in with a lot of different issues. It could be a shoulder issue, it could be a neck issue, TMJ, low back, knee, doesn't matter. They could have digestive complaints, emotional stress, immune issues, anything a patient could come in with. And throughout the years, we've been able to try to figure out what all these patients' symptoms mean and end up having a roadmap in the muscle testing. And the main reason for that is the muscle testing is really just a reflection of what's going on with the nervous system. The nervous system is going to be monitoring all aspects of life and health, and as a result, when something's wrong with the nervous system, it's going to show up in the muscle test. And it's basically our job to use the muscle testing to figure out what's wrong with the nervous system. The other beauty of using muscle testing is not only does it give me objectivity to the patient's complaints, it actually tells me what I need to do to fix the complaint. So, and you can find that fix that happens instantaneously. When you find the right trigger, the nervous system responds instantaneously. And the third thing is it provides accountability. Because if I come in and the patient is coming in for the same complaints over and over again, and I'm finding the same muscle testing findings on each visit, that means there's something wrong. Like either I didn't find the stressor, or the stressor that I found hasn't gone away. Like for example, if the patient had a food allergy and that was causing this stress to her nervous system and creating all these muscle imbalances, if she didn't stay away from that food, then the same symptoms are just going to keep coming back. There's nothing I can really do about that. But at the same time, the patient's doing everything that I tell them to, but I haven't really found the right trigger, then they're going to continuously have the same complaints. And in this case, let me just show you an example. I have a patient here, she's got some right-sided low back pain. I'm just going to show you how I can provide some objectivity to that complaint, because there could be a lot of reasons why that would be there. So I'm going to do some tests that would relate to a low back and pelvis issue. She's going to bring this leg up. I'm testing her abdominals here. She's going to go knee to shoulder. That's strong muscle. She's going to go knee to shoulder. That's strong over there. Bring that down. Do the same thing but on the right side. Knee to shoulder. Good. And she's going to go knee to shoulder. Okay. And she actually has a weakness there. Now I'm going to test hip muscle here. I'm going to do it on the left side first. She's going to bring this leg out, push out. Okay, that's weak on the left. She's going to push out here. That's strong on the right. She's going to hold on to the table. Bring your legs over this way. I'm testing this muscle on the back left side. Good. And now I'm going to do that on the right. Hold. Okay, and that's weak on the right. So in her case, she's got some right-sided low back pain. And just where we started there, she has a weakness on this muscle that's going to stabilize her pelvis, her obliques. She's got a weakness on this hip muscle on the left-hand side. And she's got a weak muscle on her right side of her low back there. And that's basically where you would get started. And you can use the muscle testing to tell you where you need to go to fix these corrections, or make these corrections.